Hi, I'm Ed Furlong, and welcome to Digital Health on Air. I'm joined by Rob Ellis, CFO at Carolina Asthma and Allergy. I was leading an independent specialty group in a crowded healthcare market down in the Charlotte area. Today, we're talking about ROI of better patient access. Rob, welcome. Carolina Asthma and Allergy has been a fixture of the greater Charlotte area since the 50s. Will you tell us a bit about the organization and how it's grown over the years?
Certainly. We're still an independent physician-owned organization. All of our physicians are board certified in allergy and asthma. It definitely has grown quite a bit since the 50s. I started working with the organization back in 2012, and we had 8 offices, 10 doctors, and 2 mid-level providers. As of this year, we're at 16 offices, 20 physicians, and 12 mid-level providers. So we've doubled in office and doctors and grown quite a bit with our mid-levels. So a lot of it, as the Charlotte and the surrounding community has grown, we've had to kind of meet that need as well.
Yeah, that's terrific growth. And Charlotte, every time I've been there recently, it's still booming. So I think you're going to have continued growth in the future for sure.
I hope so. It's a nice place to be.
Yeah, no, absolutely. In the Charlotte area and, even in the greater surrounding area, I know there are a couple of pretty significant dominant health systems, and Carolina Asthma and Allergy remains a thriving independent group, as you just said. Can you share more about the healthcare market you're competing in and some of the keys to staying independent and competing with and maybe in coopetition with those major health systems that you've got to deal with in your market?
It's a daily challenge, honestly. There are, as you mentioned, 2 very large hospital systems that own quite a bit of the physician practices in the area. So with us being independent, we find that constantly we're looking at our referral market, and we're looking at some of the previous primary care physicians and such. They're being encouraged to keep their referrals within the system. So it's getting a little more difficult. I mean, part of that in maintaining those relationships, there's physician to physician relationship. There's some marketing involved for when patients have their own, they can choose where they go. So we have to stay out in front of the patients with some marketing and our, the name and acknowledgement. As the area grows, you've got people that have been here for a while that know of Carolina Asthma, but you've got a lot of new people moving in and they don't know. So it's a delicate balance to try to maintain and work with both systems, not work against either one of them. So again, a lot of it with the marketing, and it's a tricky environment because the demographics in the market changes. I mean, I could show my age here and talk about newspapers and yellow pages and such, but that's not the market nowadays. Everything, there's online, there's digital, there's many more ways you have to reach people. And in one regard, it makes it trickier because you can gauge some of your website and different electronic demographics and social media, but it's a constantly evolving platform. So we're just reaching the public in general. It's a constant challenge.
I know, I'm sure it is, especially given the market. I know a lot of referrals or physicians are, based on relationships, and it's often even who they went to medical school with. These relations tend to persist. Are there things you're doing to try to facilitate those relationships and institutionalize those relationships a little bit more? Or anything you can share with us on that in terms of your best practices in that area?
Regarding physician, there's a lot, like I said, there's a lot of emphasis for the physicians to make those contacts. I mean, physicians are busy people. So, telling your doctors, hey, you need to take a little time out of your day to reach out to this referring doctor. It can be tricky and it can be difficult for them to catch up. We focused a few years ago, we were looking at our own systems and trying to figure out how we could help, make it more accessible to just the patient. And, for myself, just as an example, one of my primary care doctor is with one of the large health systems. And it frustrated me that to make an appointment or to contact my primary care, I had all these tools. I could go onto my phone. I was getting text and I could reappoint and make appointments and everything online. And we were not configured to do that. So, we did look at the market, different environments. We did partner with Luma, as you know, and it was a huge help in being able to offer that online presence for our patients. A lot of it started with the patient reminders. We had a system in place that did not do as great a reminder as we liked. It was a very generic reminder. And when you've got multiple offices, it sounds simple to tell the patient, hey, you need to be at this office at this location. The old system didn't do that. The old system didn't allow the patient to confirm that they were coming or cancel or reschedule. When we went with Luma, we gained those capabilities. So those functionality was a huge help for us. As we started looking at the online market, like I said, a lot of people, as they're moving into town, you tend to look at healthcare reviews or Google reviews and such. And we were not also configured well in managing those reviews. Our director of marketing, we hired a director of marketing a few years back, and she took it to heart to get more involved, help bring us into the 21st century in that regard. So she used a company called Raider8 to help manage those online referrals and reviews. Did a very good job, and I was surprised. Just you hear people talk about search engine optimization, and you don't think too much about it until you start seeing the results. So using that group really helped with the referrals and the online searches as well. Then we were able to leverage both Luma and Raider8 with the website. And you have to consider it's not just the computer anymore. People are accessing the website more through their phone than anything. So again, a lot of strategic work just to be able to reach the patient, just for the patient to be able to reach you. But it's definitely has been well worth it.
When you look at your financial side, has it been an improvement in patient acquisition and acquisition efficiency, in like improvement in no-show rates? Where are some of the things that maybe you saw the measurable improvement?
We saw, one of the things I had been focusing on was no-show and reschedule rates. As patients were trying to get through on the telephone, you found that you could never hire enough people. Patients are always backlogged, and especially in asthma and allergy, you do have busy seasons, especially in the Carolinas. If you've never been to the Carolinas, allergies can really get you in the spring and the fall. And during busy season, it was difficult for patients to get through. So we began measuring, probably back in 22, really strongly measuring no-shows, measuring cancellation and reschedule rates. And they were higher than I wanted them to be, quite frankly. And to me, it made sense in the entire in the business and in the healthcare cycle. If you can't get the patients in the door, that's problem one. So once we started initiating and utilizing these systems, I noticed immediately once we implemented them, our no-show rate dropped by a couple of percentage points just overnight. The cancel and reschedule, the rescheduling rate went up probably about 15% within the first month. I mean, it was a noticeable improvement. We had physicians. It was interesting because I'd go to physician meetings and they were complaining about their no-shows because if they're there, they want to see patients, and they were complaining about their no-shows. And within a month at the next meeting, I'm like, "What did you guys do? I've got more patients showing up. I'm busier now." And I'm like, "Isn't that what you wanted?" And they're like, "Well, yeah, but how'd you do it?" I felt that it was a success when the physicians noticed it that quickly.
Yeah, no, absolutely. They're critical here. In fact, we hear from a lot of organizations, really of all sizes, shapes, how they're impacted by shortage of staff and providers. And how do you use some of these efforts to retain, attract providers as you grow, and perhaps also comment on the staff side, because that's equally important to service your patients.
On the provider side, we have a good network with a lot of the medical schools, particularly the ones where the allergy and asthma fellowships and such. We've got a very good pipeline. A lot of our physicians have come from those schools. So they keep a lot of contact with the schools. We're always getting resumes and CVs and inquiries from people that are finishing up their residency and want to know, do you have an opening in Charlotte? For a physician that has a little bit of an entrepreneurial side, that doesn't want to just become a cog in the wheel of the hospital system, an independent practice is very attractive. Charlotte market is it's an attractive market. As you said, it's still booming. So a lot of times we'll have physicians reaching out to us. Part of it is, what is our strategic focus for the next year? Are we looking at opening a new office? Are we looking at adding physicians? Do we have a demand that's hard to meet right now? One of them, if we talk about metrics, we look at a lot of different metrics, and one of those is patient access. So are we having an issue where we've had a physician retire, or as physicians retire, we need to try to find some new physicians to come on board. So a lot of the physician recruitment side looks at the strategic direction. What are we planning for the next 12, 18, 24 months? And, this past year, the past 12 months, we opened 2 new offices. So obviously we needed some help with that. We had one physician, actually I take that back, 2 physicians retire. So we had to replace that. This year, knock on wood, it's a little slower. We're not planning as much growth this year. So the physician recruitment is not as huge an aspect. Now, staff recruitment is always an aspect because you have, as most people can tell you, it's hard to find good talent. And demographics and statistics will tell you right now we're looking at more people retiring and less people coming into the job market. The population, the demographics are shifting and people are not coming into the job market as quick as they did 20, 25 years ago. So, the talent pool is shrinking and it's hard to find good talent. You look on the clinical side and you've got a lot of people, nursing and techs that are interested. And it has to be competitive. When we're competing, not just for patients, but for staff with the larger hospital systems, they're throwing out bonuses and cash and benefits that as a larger organization, it's tough to compete on some of that. We have to look at the fact that you're not going to be working weekends. You're not going to be having to cover the ER. You're looking more 8 to 5 type scenario. You're looking at a closer working relationship with the physicians that you're with. On the administrative and the business office side, remote and hybrid workplaces are a constant challenge. For clinical side, you've got to be on site to see the patient. But on the business and administrative side, a lot of people want to work from home or have the option to work from home all of the time or some of the time. We have a lot of single parents who, there's childcare needs and you have to have some schedule flexibility. So it is a constant it's constant work to be able to keep and maintain good staff. And then you have times where there's just, a surprise staff member has an offer that they can't turn down. And then you're dipping back into the talent pool again. So there's no magic silver bullet for it. It is a constant effort by the HR, by managers, and just, to keep that door open for when good talent comes in.
Do you find that for the investments you've made in, you mentioned a couple of different software solutions and patient access programs, does that help? Is that valued by the physicians? You mentioned one asking you, how do you achieve these good results? Wondering also if staff, because, one issue we do see here on staff is that if they have older technology, they have to deal with a lot of routine tasks that really are better handled through better engagement tools with patients, so that staff can get frustrated with that because they're not able to focus on the patients that really need their help and the resource. There's always cost pressures and not enough staff. So I'm wondering if some of these programs, in addition to helping patients and in their engagement and access, has also helped with some of these more HR matters with both physicians and staff.
They have helped to an extent. A lot of it, it's funny with human nature. Just after something's been in place for a few months, that's kind of the norm now. So you have to remind them every so often, hey, remember how it was before this, and you're having to constantly look at the programs and the softwares you're using. There's still certain inefficiencies with our EHR system that could be better, could be fixed, and we're constantly working and looking at those things. We do have to remind the shareholders, the physicians, we meet with them often and go over financials and different things. And as you said, there's a lot of financial pressure. And when you start looking at line items, IT is always a large line item. But it's like, okay, with this line item here, I've had to explain to them before, you're spending X amount on this system. Well, what this system is doing is X, Y, and Z. And because of that, I'm not having to pay a certain amount because I don't have to have 6 staff members doing this. And this system doesn't call in sick. This system doesn't need benefits. So as cold as that sounds, you have to have those talks with them to say, this is an investment you've made. You've invested to better the practice, to allow more patient access. So it's always a give and take. again, there's always a feel of what have you done for me lately, but it's good to remind them and it's good to track. It's good to have the metrics to say, here's what's been done lately and here's how things are going.
Yeah, one thing you touched on there was it's absolutely critically to have 24/7, solutions that work 24/7 for patients, because a very high percentage of patients and an increasing number we found are, basically doing things off hours.
Agreed.
And you're not going to be able to staff that. So that's critical. It's look, as for CFO, you're obviously deeply engaged and focused on patient access. So it's great to see, but maybe you could share a little bit about what sort of caused you to realize this was a critical issue, but then also second part of that is what metrics, now that you've invested a lot in it, what are some of the key metrics that you think are important to monitor?
Well, in working with medical, I've worked with healthcare over 25 years. I mean, the gray hair didn't come just overnight. So in working with healthcare, you look at healthcare as a business. You look at the business cycle. If you can't get customers in the door, business is going to fail. So in healthcare, that means you've got to be able to get patients in the door. So no matter how good your physicians are, if patients can't get an appointment, they will go somewhere else. The majority of them, we're in a very fast-paced culture. If I can't get through in 5 minutes, I'm done.
Yeah.
So realizing that patient access concern, and again, starting to look here, you hear the complaints about no-shows, and you start looking at schedules. So that's when I became very, within this practice, looking at the no-show rate, realizing to me it was way too high, that we had to be able to focus on that. Metrics, there's a lot of, I'm still a finance person. Every day I'm looking at cash flow metrics of collections as well as expenses, looking at how we're doing compared to projections and budgets. I'm always, you got to manage the business side of it. But a lot of the other metrics, as you said, with patient access, I'm looking at appointments on a weekly basis. We start literally at the end of a week looking ahead at what's on the schedule for next week. And it's not just how many patients are coming in. We're looking at where they're going in their offices, or are they, signed up for physicians versus mid-level providers as well. I'm looking at metrics of not just the sheer numbers, but a fill rate. Let's say if you've got a physician and they've got 18 patient slots a day, and they've got 15 patients scheduled for that day. Okay, they're at about 5/6 of a fill rate right there. I need do I have another physician somewhere that they've got 16 slots and they're only seeing 8 patients? So how can we fill them up more? So at the end of the week, we start looking ahead and projecting who are we expecting to come in the door? What patients are we expecting for next week? During the course of the week, we look back at the previous week and build the statistics from there. Middle of the week, we run a report. One of our metrics we track is also third next available appointments. Some people in operations, they'll tell you that's kind of a good proxy for patient access. When, how far out is it for a patient to get the third next available appointment with a provider? And if I've got openings within 1 week, then I've probably got a good bit of access. I need more patients. If I'm somewhere between a week to a month, that's probably the normal ebb and flow of our business, and that's that kind of a steady stream. If I've got providers or locations that it's taking more than a month for that patient to get an appointment, I've got problems because they may not be willing to wait that long. And if I've got providers that's more than 2 months, I've really got to start looking at that location to say, hey, do we need to expand? Do we need to get more help in here? That's when the physician recruitment issues come in. Once a month then, at the end of month, for the month-end reporting, that's when I'm pulling the data on my no-shows and my reschedules. Not just, what's our percentage of no-show patients, but we look at a lot of the patients when they cancel an appointment, are they canceling in time to where I can, we can reach out to them, or a patient can call in, or the wait list will reach out to them and say, hey, we've got this opening. Do you want to come in for this? So I'm looking at a cancellation reschedule rate to see, hey, for an opening, how many of those openings did I fill? So those, at a high level, just those are some of the patient metrics that I feel like are very important to keep a track of. And as you mentioned, unfortunately, I'm a little hands-on on these things. I mean, one of my things I've always enjoyed, when you start looking at healthcare and all of the data that we have, all that data, if you can get through it and understand what it's telling you and what it means, That plus trend analysis can tell you a lot about the practice. It can obviously tell you where you've been, but it can also point where you're going.
Yeah, no, that's great. I mean, definitely focus on the data, the analytics, the reporting, but also what's clear in your discussion is, Rob, you sort of really integrated it into really how your organization runs, right? That seems to be the critical piece of success here for patients.
It's critical. I mentioned earlier, looking ahead at the week ahead of the appointments coming in. Our clinical managers and our front desk managers, they use that data to say, okay, if I've got a busy day here, I need a lot of staff here. If it's less busy from this office, I can pull from that office if I need to. So we can flex the staffing a little bit based on some of those metrics. So it does permeate through the organization.
Yeah, this has been a great discussion. Any final words of advice you might have for your peer CFOs out there if they're looking to, improve their patient access and their programming here?
You've got to put yourself in that patient's shoes and look at the obstacles for getting in the door. If you or a family member blindly try to come in as a patient to kind of see, can I get an appointment? Why is it going to take 3 weeks? You need to understand what the patient's going through, and then look at what you're going through with other providers, your primary care or whatever, to say, okay, how can I improve where I'm at? You've got to be constantly looking. Technology's evolving and changing. The market is constantly changing. Complacency will get you run over.
Yeah, it makes a lot of sense with technology evolving the way it is. We could spend another half hour on that, but we won't do that
all day if we wanted to.
We won't do that today, especially with AI and other things going on. But Rob, this has been really, really helpful, insightful look into, an independent organization that in a challenging market, but not just surviving, growing and thriving, making smart investments with a real focus on, patient experience and patient access. So that's really been terrific. Appreciate it.
Thank you for the opportunity. I've enjoyed it.
Yeah, thank you. Take care. Have a great day. Bye-bye.